Oops, sorry. It looks like the video got cut off. So this is the second part. So what I was saying is that you almost have to kind of fit or try to look where you belong as you're trying to navigate these complex aspects. And what I was saying earlier, it really impacts your health or mental health because you feel like you cannot be 100% yourself, and that impacts your personality structure, that impacts like your assertiveness or how comfortable do you feel with yourself. So obviously it impacts your self-esteem and how you view yourself, and it also generates feeling of anxiety and depression as you have to navigate this uncomfortable um, tensions. Think also about I think two terms that are mentioned in there, that goes back to the issue of trying to fit in, of me hiding my sexuality from my family or hiding aspects of myself from my family. The issue of blanqueamiento and mejorando la raza. Whenever, even for Puerto Ricans, which we have a different, as I've said, migration history, when we talk about mejorando la raza or blanqueamiento, even though, like I say, our experiences of race and ethnicity are very different in our specific Latin American context, the truth is that there has always been an association, and you can even, maybe some of your parents or relatives would say that if someone in your family is of a darker skin tone, or someone in your family is kind of um, poor or from lower SES, you always get these messages that, oh, you cannot marry someone from your same group, or you cannot marry someone that's darker skin or black, because we gotta improve our race, right? We gotta assimilate to what we socially view as what it should be like the standard or the perfect race in a sense. So those messages are also well ingrained in Latino culture. So there's this kind of notion that becoming more white or improving our races, right, by becoming more white is also going to give us access, makes us more accepted in the US context, and give us access to other resources that we might lack. And I think this is something that I always tell students that makes me feel, I guess, very sad. And I wished I had like a better response on how to manage or address this in social work practice, and even in healthcare settings. But I think the best thing that we can do is start, number one, to acknowledge and be open to having those conversations with clients, which are very uncomfortable. Even for me, the issue of sexuality, what I ended up doing with my clients is like admitting to them and becoming more genuine to them. You know what? I don't know much about this, but I want to learn from you. So why don't you share your story with me? So open yourself in a genuine way, and it's okay if you don't know certain things. It's okay as a health practitioner or a social worker, um, you don't understand certain processes. The best policy is to be open to listening and exploring with your clients or your patients, even if you don't know everything. But you admit that shows to your client or patient, not only that you're genuine, but that you're someone that's willing to hear them in an open and non-judgmental manner. And I think that's a good place to start, because if we keep kind of keeping this secret or being afraid of having these discussions because I'm not sure how everyone's going to react, that kind of replicates the same messages or the same things that we're criticizing, that we need to leave hidden, secluded, that this is something to be ashamed of, that I cannot be who I am in this country. So the best thing that we can do is start breaking those barriers by engaging genuinely in those conversations. So it's been a little bit of a long video. I'm gonna cut it off here, and I look forward to quiz number 9, and I'll start grading those next week. So yes, stay tuned for more videos next week, and then for your reflections in particular. Bye bye. Take care.